This is Chapter 21 of Maternal Newborn Postpartum Infections. Postpartum infections are complications that can occur up to 28 days following childbirth or a spontaneous or induced abortion. Fever of 100.4 or higher after the first 24 hours or for 2 days during the first 10 days of the postpartum period is indicative of a postpartum infection and requires further investigation. The infection can be present in the bladder, uterus, wound, or breast of a postpartum client. The major complication of a puerperal infection is septicemia. Uterine infection, wound infection, mastitis, and urinary tract infection are examples of postpartum infections. Early identification and prompt treatment are necessary to promote positive outcomes. Infections: endometritis, mastitis, and wound infections. The immediate postpartum period following birth is a time of increased risk for all clients for microorganisms entering the reproductive tract and migrating into the blood and other parts of the body, which can result in life-threatening septicemia. Uterine infection is also referred to as endometriitis. Endometriitis is an infection of the uterine lining or endometrium. It is the most frequently occurring puerperal infection. Endometriitis usually begins on the 3rd to 4th postpartum day, generally starting as a localized infection at a placental attachment site and spreading to include the entire uterine endometrium. Sites of wound infections include cesarean incisions, episiotomies, lacerations, and any trauma wounds present in the birth canal following labor and birth. Mastitis is an infection of the breast involving the intralobular connective tissue and is usually unilateral. Mastitis can progress to an abscess if untreated. It can occur as early as 7th postpartum day. It usually occurs during the first 6 weeks of breastfeeding, but can occur at any time during breastfeeding. Staphylococcus aureus is usually the infecting organism. Risk factors: UTIs, mastitis, pneumonia, or history of previous venous thrombus. History of diabetes, immunosuppression, anemia, or malnutrition. Prolonged labor, postpartum hemorrhage, operative vaginal birth, episiotomy, or lacerations. Mastitis, milk stasis, which can be caused by a blocked duct, engorgement, or a bra with an underwire. Nipple trauma and cracked or fissured nipples, poor breastfeeding technique with improper latching of the newborn onto the breast, which can lead to sore and cracked nipples. Decrease in breastfeeding frequency due to supplementation with bottle feeding and contamination of breast due to poor hygiene. Expected findings: puerperal infections, flu-like manifestations, body aches, chills, fever, and malaise, anorexia and nausea. Endometriitis: pelvic pain, chills, fatigue, loss of appetite. Mastitis: painful or tender localized hard mass and reddened area, usually on one breast. Influenza-like manifestations like chills, fever, headache, and body ache, and fatigue. Physical assessment findings: puerperal infections is elevated temperature of at least 100.4 for 2 or more consecutive days and tachycardia. Endometriitis is uterine tenderness, dark, profuse lochia that is either malodorous or purulent, temperature greater than 100.4, and tachycardia. Wound infection: wound warmth, erythema, tenderness, pain, edema, seropurulent drainage, and wound dehiscence, separation of wound or incision edges, or evisceration, which is protrusion of internal contents through the separated wound edges, and temperature greater than 100.4 for 2 or more consecutive days. Mastitis is axillary adenopathy in the affected side and large tender axillary lymph nodes with an area of inflammation that can be red, swollen, warm, and tender. Lab tests is blood, intracervical or intrauterine bacterial cultures to reveal the offending organism. WBC count, leukocytosis. RBC sedimentation rate is distinctly increased, and RBC count is anemia. Nursing care: obtain frequent vital signs, assess pain, assess fundal height, position, and consistency, inspect breasts. Puerperal infections: Use aseptic technique for appropriate procedures. Perform proper hand hygiene and don gloves for labor, birth, and postpartum care. Maintain or initiate IV access. Administer IV broad-spectrum antibiotic therapy like penicillins, cephalosporins, clindamycin, and gentamicin. Provide comfort measures like warm blankets, cool compresses, depending on findings. Client education. Report signs of worsening conditions. Adhere to the treatment plan with the completion of a full course of antibiotics. Preventative measures include thorough hand washing and good perineal hygiene. Endometriitis. Collect vaginal and blood cultures if prescribed. Administer IV antibiotics. Administer analgesics. Client education. Perform effective hand hygiene techniques. Maintain interaction with the newborn to facilitate bonding. Wound infection. Perform wound care. Administer IV antibiotics. Provide or encourage comfort measures like a sitz bath, perineal care, warm or cold compresses. Teach the client that good hygiene techniques include changing perineal pads from front to back and performing thorough hand hygiene prior to and after perineal care. Mastitis. Administer antibiotics. Client education. Breast hygiene can prevent and manage mastitis. Thoroughly wash hands prior to breastfeeding. Maintain cleanliness of breasts with frequent changes of breast pads. Allow nipples to air dry. Proper newborn positioning and latching on techniques include both the nipple and the areola. Release the newborn's grasp on the nipple prior to removing the newborn from the breast. Use ice packs or warm packs on affected breasts for discomfort. Continue breastfeeding frequently, at least every 2 to 4 hours, especially on the affected side. Manually express breast milk or use a breast pump if breastfeeding is too painful. Breastfeed or pump frequently, emptying the affected side. Rest, take analgesics, and maintain fluid intake of at least 3,000 milliliters per day. Medications for endometriitis. Clindamycin, cephalosporins, penicillins, and gentamicin. Classification is antibiotic. Treatment for bacterial infections. Take all medication as prescribed. Notify the provider of the development of watery, bloody diarrhea. And notify the provider if you're breastfeeding. Therapeutic procedures. The provider might need to open and drain the wound or perform wound debridement if indicated. Urinary tract infection. UTIs are common postpartum infections secondary to bladder trauma and cured during the delivery or a break in aseptic technique during bladder catheterization. A potential complication of a UTI is the progression due to pyelonephritis with permanent kidney damage leading to kidney failure. Assessment. Postpartum hypotonic bladder or urethra, epidural anesthesia, urinary bladder catheterization, genital tract injuries, history of UTIs, and cesarean birth. Expected findings. Reports of urgency, frequency, dysuria, and discomfort in the pelvic area, fever, chills, malaise, and physical assessment findings are change in vital signs, urine is cloudy, blood-tinged, and malodorous, urinary retention, pain in the suprapubic area, and pain at the costrovertebral angle, which is pyelonephritis. Diagnostic procedures. Urinalysis for white blood cells, red blood cells, protein, and bacteria. Nursing care. Obtain a random or clean catch urine sample. Administer antibiotics and teach the client the importance of completing the entire course of antibiotics as prescribed. Encourage the client to increase their fluid intake to 3,000 milliliters a day to dilute the bacteria and flush the bladder.